Okay, so just a few housekeeping rules just before we start the webinar. The session will be recorded. All attendees will be on mute and cameras will be off for all attendees as well. If you have any questions or any comments, please do use the chat facility. We have some colleagues on from DigPacks as well, so we can answer any questions as we go through there. If you have any questions after we've done the demonstration, then please feel free to ask any questions there too. If we don't have time to answer everything, we will contact you after the webinar. Okay, so just want to introduce myself, and then I'll let Owen introduce himself. So for those that haven't met me before, my name is Karen. I'm head of customer success here at DigPacks. I've been here just over 6 months now, but my background is working for Microsoft Power Platform and business applications partners for the last 10 years. Over to you, Owen.
Thank you, Karen. Good morning, everyone. I'm Owen Foster, one of the Power Platform developers here at DigPacks. I've been with the organisation for around 3 months now, but my previous experience was in a development Power Platform space, along with a few other areas in the NHS internally at Northamptonshire Healthcare Foundation Trust, and that was for 9 years previously. Really good to be here with you all today.
So going to do a quick introduction to DigPacks and our solutions. Then I'm going to hand over to Owen, who's going to be talking about what unattended RPA is, some incumbent automation solutions and how unattended RPA from the Microsoft Power Platform is different from those. Owen will be talking about a case study with Berkshire, and then talking about some of the benefits of unattended RPA too. Then we'll have a summary and close. As I've said, any questions, please feel free to put them in the chat as we go, or any comments. But if you want to wait until after we've shown the solution, that's absolutely fine. So just some information about DigPacks. So we've been going for about 6 years now. We emerged from the rising demand to leverage low code or no code solutions. We work primarily in the healthcare sector for NHS trusts, delivering power through that Power Platform. And we are exclusively kind of focused on the Power Platform solutions as well. We're a local consultancy, so all our employees are within the UK. We have 2 offices, one in Hatfield and one in Cardiff. And we are a Microsoft certified solutions partner, and we work with NHS England and Microsoft directly. So just some of the highlights of DigPacks. We have a catalogue of pre-made Power Platform solutions. So that's in the area of applications, automations, copilots, AI agents, and also with external facing websites too, all utilising the Power Platform through there. They have been made in conjunction with trusts or utilising the relationship we have with NHS England as well to focus our solutions on NHS trusts, and that's on Central Tenant and also Local Tenant as well. And we deploy rapid delivery methodologies as well, so we want to make sure that that time to value is as short as possible. And so by doing the agile process of delivery, what that means is we have an element of knowledge sharing in there, of enablement as well, so our customers can eventually manage their own solutions and start delivering their own training and enablement and usage of the solutions as well. Some of the solutions that we have here, we like to put them into 3 different buckets, just to let you know that as our clinical solutions expand, we'll have a separate area for those as well. So the 3 different areas that we have experience in creating solutions for, either for specific trusts or ones which are available to everybody. First of all, it's in the areas in compliance, so looking at things like document management solutions, DPIA, and referral migration. Then going on to workforce and HR, so we have a staff hub, and within that staff hub, there's lots of different processes and areas for forms for HR and staff. Some things like change of circumstances, for example, supervision apps, feedback apps as well, and onboarding. Then we look into the areas of operations, so we have vaccination hub, e-observations, waitlist optimization, and patient appointment booking too. And then below, we just have some of our NHS clients in here. So like I said, we do work with over 30 trusts. There's just some of them on here that you may work for or you may recognise or have worked with in the past. Okay, I'm now going to hand over to Owen.
Thanks very much, Karen. So, as the title suggests, we are looking at Power Platform use for unattended RPA. A very kind of hot topic and a really interesting topic at the moment, particularly with the advent of NHS England looking to make unattended RPA through Power Automate Desktop available in the NHS Central Tenancy. But just as a kind of primer for any of you who aren't entirely familiar with the concept of RPA, I'm sure many of you are, but really what is RPA and what is it in the context of Power Platform? So first up, it creates software robots. These robots act as standard users interfacing with existing UIs, and they sit atop your current architecture. So thinking about them much like a user would interact with a piece of software that can exist on top of that, not necessarily integrating with things like APIs and those kind of things. It's more acting as a user would, interacting with that UI directly. So that's what gives you your kind of ability to work with existing technology and make that really flexible. And with that comes your kind of scalable deployment. So since a RPA tool, and particularly with unattended RPA tools, they can sit in the background working with an individual business process, and that could scale out to deal with a number of different potential solutions, sitting up to kind of queues with interacting with different various systems. Take, for example, if you've got multiple different clinical systems in your organization with different rules, different processes, say a common one, something that we'll show later is sort of thinking about referrals, whether you need to think about how those come in via different routes, that kind of omni-channel different routes into your environment, your organization, and which solutions they then need to be pushed towards. And with that, like I just said, it works alongside other technology. You're less restricted by, say, existing integrations in API requirements, as long as there is those kind of user credentials in to allow a bot to access the relevant solutions. You are able to pick up the access and any data in a structured format and then act at scale automatically as a user would do. And within that, particularly important with compliance, any kind of potential use of RPA for any kind of personal identifiable data, or with your clinical systems, that it follows that rules-based processing. So whereas your average user, they have the ability to kind of go off script and kind of do different things, your bot is very much based on that rule set and step-by-step process. So the bot will only follow that kind of auditable process that has been set out for it. In the context of the Power Platform, what we're really talking about is what I mentioned earlier. It's Power Automate Desktop. Some of you may be familiar with Power Automate Cloud Flows, a really powerful automation tool, both for kind of business automation processes, but also enterprise solutions, connecting different data sources, a really flexible automation tool with 1,500 plus connectors to various different Microsoft and external platforms. But the Power Automate Desktop tool through standard RPA and unattended RPA really does give you that flexibility to integrate with all different kinds of solutions, as we put out here, in terms of interacting with the UI and the various different options you have. But obviously today we're talking about unattended RPA, and appreciate that this may be a kind of a new distinction for some people, so really just want to outline what the actual difference was between the two of them, where some of the use cases may differ, and sort of what's best for which version of RPA you think would really bring efficiencies to you. So in terms of attended, that's what we're talking about, a process that requires monitoring user intervention. Think about it more as there's a robotic user sitting next to you or on your device. Those are usually, they're relevant for processes with real-time decision making. So say, for example, you've got a user who is interacting with a patient on a phone, or a colleague on a phone, and they then want to trigger a process that's either transcribed or logged and then automatically generated into a related solution. That's where your attended RPA would come in. It's that manual triggering of that process directly. It's a very useful process. It can really provide business efficiencies and integrations with existing solutions, but that's really where you want that person to be fully in the loop. And from a perspective of the Power Platform as well, there is that Power Automate desktop, not unattended kind of process there, where that is sitting on a direct machine. It's being run from a device that a user would have access to. So that's really what we're talking about with attended, and that might be what you're familiar with in terms of previous RPA work. I know myself, I've had previous experience of having several laptops in a room all running as users, very much a kind of attended RPA with someone checking over them to see how they're doing. But then unattended RPA, where's that real distinction? What value and difference are you going to be getting out of those? So that's all around, thinking of a bot sitting in a cupboard, for want of a better phrase, that undertakes the processes independently. It's on its own, still with oversight, still with logging, still with tracking, still with the ability to, within its rules-based processes, identify exceptions and notify you where you need to come in and kind of have a look at something's gone wrong. But it is for those repetitive processes. So the repeated tasks, those manual tasks that you, your administrators, your clinicians, your colleagues, whoever may be doing these kind of processes, anything that they're doing repeatedly that could really benefit from that automatic integration in, and there might not be the opportunity to do that through a standard kind of integrated method. So any kind of repetitive task, but that does also expand out to not necessarily thinking of it just as integration. You've got the option to think about all kinds of different processes that you might just consider to be standard, writing emails out, writing documentation, transcribing things. If there's a process that fits within that unattended process and that is a logical route to go to, that's definitely something that can be considered and that we at DigPacks can help you with. And of course with that, whereas attended is manual, unattended is automatically triggered and scheduled. We're talking about a 24/7 365 days a year kind of bot that is always running, always accessing the information, always kind of processing things in the background for you. So really looking at that as that supporting efficiency. As with anything, even unattended is still going to need that kind of oversight and that policy in place to make sure that it is checked. But that's the real value you get from that unattended RPA, and that's the real difference between the two. So we just go forward to what are the benefits of it? What are the benefits that you're going to get, and particularly what benefits are you going to get in Power Platform unattended RPA as well? So in terms of benefits, we've got a few down here. One thing that I did just mention there is that's that auditability and compliance. What you're able to pick up from an automated process is that it will be logging every single action that it undertakes. So you will have a full audit history of everything that has happened in that process, not necessarily just logging the activity in the clinical system as you'd normally get from, say, audit logs from your EPRs or related pieces of software like those, but also any actions that it performs outside of those, which buttons it clicks, which order it does it in. You've got that full compliance, and within that business process as well, you've got the assurance that it's following a standardized process. Obviously not saying that anyone else interacting with your clinical systems isn't, but you do have that kind of enforced software that is doing that. Then there's the ease of implementation. Now, obviously, there's a lot of technical challenges and a lot of sort of considerations to get through when you are looking to implement unattended RPA. But its ease of implementation really is the element that, particularly with Power Automate Desktop, and the benefit that you get from that from, say, other alternatives like Blue Prism or anything like that, is that you are able to integrate it with existing platforms, particularly with the Power Platform. Power Automate Desktop does integrate with the entirety of the Power Platform suite and also links into all of the Office 365 or Microsoft 365, sorry, areas too. So that ease of implementation means that you're able to use that within your existing ecosystem, but also from the perspective that you're not beholden to API connections. So any of you that are familiar with integrating between clinical systems requiring FHIR standards or HL7 standards, you are still, of course, needing to follow certain policies and compliance guidelines, but you're able to sit that on top of your architecture and customize it to whatever individual need that you've got. There's rapid return on investment within that. So you could look at this as scalable, like we were saying earlier. Particularly with Power Automate Desktop, you can get one individual bot license, get that running, identify a key process, and then scale that over time. And that bot could even become more complicated, deal with multiple different queries, say with referrals, and send them to multiple different locations. And that's the same with the breadth of opportunities that those can offer. So we're not just talking clinical, we're talking corporate, HR, finance, any kind of software, any kind of process that you think, well, this could really be automated. There's a real opportunity to link into this. You can think about it in the terms of unattended RPA. Can you have that bot off to the side doing that job and save up time that you could be doing elsewhere? And again, the things we mentioned around 24/7 operation, you've got that full availability. Bots don't need to take days off. Bots don't need to sleep for the most part. They can continue to run processes in the background. So if you've got a 24/7 service that really needs to meet your targets and consistency, that's something that you can do through an unattended RPA bot. So there's a real kind of benefits that come with it. But of course, with that, there are challenges and there are considerations that you need to keep in mind, particularly with RPA generally, but also some things that you need for sort of Power Automate Desktop unattended RPA too. First off, and it's one that I'm sure you're all familiar with, that poor processes that exist will not be fully resolved and fixed by an automatic process. Part of the analysis and the business analysis of your processes must be identifying where the pain points are and where things can be made more efficient within the kind of digitizing or digitalizing of a process with unattended RPA. And again, that's something that we at DigPacks can kind of work through and help you on as well. High exception rate, and that kind of links into unreliable applications. So with any automatic process, if there's kind of any outliers in the process or anything that might come up, so I've had experience previously where, say, you've got a Windows update pop up or an interesting quirk in an application where a pop up might come up in a different location. You need to be able to account for those in your process. So part of the Power Automate Desktop tool is where you are able to put that business process and those exception flows in place so that you can integrate directly and identify where those exceptions need to be dealt with. But any kind of high exception rate needs to be kept in mind. Potential scope creep. This is true for any kind of exciting, really efficient new technology. It's important to make sure that you identify the key processes that are going to really support the efficiencies you're looking to make with unattended RPA, and make sure you don't sort of creep too much outside of that scope. I appreciate that it's very easy to get excited and go out of those. And then with your standard, you've got employee resistance. There is obviously that perception that a bot's going to come along and it's going to take away your job. That's not necessarily what you're talking about here. You're talking about supplementing and enhancing the processes. So how can those processes be made more efficient? How can people's time be made better use of? And how can it free them up to do something that is, more relevant to their role? Often you've got clinical staff who are doing a lot of admin work where they could actually be undertaking more clinical contacts instead. And this is particularly one for the kind of implementation as well, the access to the test data. RPA processes really need to be made well learned. So much like an AI model, you need to have the key kind of information that will allow you to identify how this process should run, how it should interact with the UI and the various different software that it's going to be linking into, and making sure that the available test data that you have on hand is applicable and realistic to what the actual process would be is an essential factor in terms of getting up unattended RPA. Particularly with Power Automate Desktop, it has the ability to run based on existing processes. You can kind of record processes much like you can record macros, if anyone's ever done that, kind of get an idea of how that process might look in a simplistic form. But you can expand that out to use more kind of test data in a structured format, and if that is applicable and accurate, you have a much better end result with less exceptions at the end of it. In regards to when actually to use this, though, there's obviously the idea that you need to make sure that you're using RPA and unattended RPA in the relevant scenarios. So when do you actually want to use it? Well, there's a few kind of scenarios we've got here. So the obvious one is unnecessary manual processes. So if you've got that identified process that's repeatedly happening, you know that that person or group of people could be made better use of elsewhere? How can you take that process and turn it into an automatic one? But that process also has to be applicable to the kind of decision making or lack of decision making that an unattended bot would need. With attended RPA, you've got that person in the loop and they're making those decisions. When we're talking about unattended RPA, what we really want to make sure that we're keeping in mind is that the process can run automatically with a set of business rules and doesn't need a lot of manual intervention from an individual. So that's really where you get the real benefit of unattended RPA. Again, obviously, time-saving benefit. Is it going to save you time? In most cases, yes, it will. It'll move that time deficit off from someone and allow them to undertake other opportunities. And a fairly big one is where other integrations are not possible. Working previously in an NHS trust, and I'm sure you've all experienced this, is that there can sometimes be quite a lot of difficulty in integrating loads of different systems, particularly different clinical systems that just don't talk to each other and don't offer the opportunity to talk to each other. So it's a really important thing to consider that, well, if there aren't those other integrations possible, how can you make best use of this layer on top of your existing architecture to pull through structured data and then integrate between the two of them? That's where the real power of unattended RPA comes from. If you can't get that API connection set up, maybe the RPA can do that for you. Just checking that we've not got any questions in. Seen Bitches, you've asked any questions in the chat, but yeah, like Bitches says, if you've got any questions throughout, do feel free just to pop them in and we can kind of work through them as we go through. So the kind of general use of Power platform for unattended RPA, when it can be used best, but where that will really show you that value in terms of when to use it and what the challenges might be are in some of the case studies that we've got. So there's a product that, say, we're looking at in terms of referrals, and there's some existing work that we can also show you that was done previously with Berkshire Healthcare NHS Foundation Trust, but this is To Refer, our referral solution that includes RPA. So where did the challenges from this come from? And just thinking back to what we just spoke about, how are they applicable to unattended RPA? So there's a lot of manual effort per the referral. That was around 15 minutes per referral, and you're talking sort of 14,000 referrals over the case of like a year or so. So that's really a lot of time spent that could be made more efficient. Incomplete information. This is a huge thing that you can get out of unattended RPA is you make that structured data. You're taking the data that you might miss, particularly if you're taking phone calls or emails. You might miss key information, then have to go back and resolve that. With unattended RPA, you're looking at structured data that can be picked up and then loaded into those key systems. The lack of traceability, we said that earlier, there's not as much tracking with the person doing this. You've got system logs, obviously, but an RPA process will log all of its activity, and particularly an unattended RPA process sitting in the background, that's going to be logging every action it undertakes. So you have that real compliance and auditability of everything that happens. And you're reducing, risk of errors is a big challenge with this. You're asking people to copy and paste a lot of the time information from one place to another, and that's a very easy scenario to accidentally put the wrong bit of data in the wrong field or the wrong person's data into the wrong person's record. And then you're looking at it also from the referral pathways, but thinking about the care pathways as well in terms of how does this technology impact the clinical process. If you've got these more efficient automated robotic process automation tools, you're able to actually make that referral pathway and the referral to treatment time potentially a lot less than you would do if you were saying doing that manually. So this is where the work that was done in partnership with Berkshire came into play. So this was a referral migration, so taking from ERS to RIO, the electronic patient record. Again, there we've got that 15 minutes per referral, 14,000 referrals, and a lot of human error potential within that. So what that did is it would run through the ERS, it would poll the various different areas within that. And some of you who may have attended our previous referrals webinar may recognise some of this. So just sort of bringing this back into the conversation for unattended RPA. And this is where it would poll the ERS solution for various new referrals. It would pick up any attachments, any key information, and then migrate those automatically to create a new transfer and referral record in a central management application that we'll show you shortly. It's then able to distribute the waitlist letter and cancel original referral. So kind of that entire front to back process, as well as that further integration directly into the electronic patient record as well. And you can see some of the benefits that are down there in terms of the hours saved. You're really adhering to your SLAs. So since this is running 24/7, you're saving a lot of time and keeping on target, as well as removing your backlogs and any potential errors there may be. What I can just show you now shortly is a quick video that I'll just sort of talk over that actually shows some of this working in real time. So here is actually an example of that robot working. You'll see where it highlights in yellow that it's actually doing those actions. This is what it actually looks like when the bot is working. So it's able to actually scan that e-referral service, pick up the key data, grab the attachments all automatically directly through this process where it's running in the background. And it can download every attachment, and that's where you get the real benefit of unattended RPA, where it can access all the various different areas of a system. That running on a virtual machine or a server in the background, you're not necessarily worried about that being out. So you've also got a layer of security as well in the background of that being securely locked away. But as you can see here, it's entering all of the information automatically, picking up all of the file types, as well as all the supplementary details that you do get from that referral document. And then, as you can see, it'll also create the referral directly in there. So it can move from screen to screen, from software to software, automatically picking up the information and moving through. So imagine this is sort of off in a side room, off in a locked server room, and this is just running as a process on your virtual machine. Again, all through Power Automate Desktop, all thoroughly tested. And you know, all the exceptions in place for all of this in terms of picking up all of the information. So the robot just creates a new referral, puts all the information in, and you can also see as this is running through how much faster this is. The robot knows exactly which pixel perfect area to select, which control to select, and can do that as fast as possible. And we're even talking about creating these letters here. So as I was mentioning earlier, it's not just around system integration between two or entering data. You've also got the possibility of exporting data. Just an example of what that referrals product looks like. So just to kind of frame it in the context of, while the surrounding automation tools can interact directly with the various different systems at the back of it, through the power of Power Automate Desktop Unattended RPA, you're then able to link in with existing Power Platform solutions. And with that, what you're able to do is create, say, a Power app like we've got here, this 2 referrals app, where you've got a central management area where you can record all the various details via the bot, pull out information, and then be able to push that into the relevant electronic patient record. In the example that we've got here, what this does in the background is that pushes this out to Rio. But what this solution does, just as a sort of wider context of it, this 2 refer solution, it scans for email content, so email referrals that might come in via primary care, for example. Those are then processed, automated. The information within those and the documents can be picked out using AI builder automation. So that's where you get another set of value from using the Power Platform solution. You also get access to the existing AI builder and even, say, Copilot Studio AI tools to support with document analysis, field scanning, sort of scraping the information into a structured format. So what that'll do is that'll put it through in this sort of structured application, which includes the ability to filter to key bits of information as well out the back of that, generate PDFs in this application too, and then thinking about it from the context of the other end of the application, how that then pushes that out in that structured PDF format, can then log that against the patient record. So you could even be thinking about including attachments generally against referrals or anything that comes through. Finally, just a quick example of how that auditing also works. So we've also got the ability to where we can audit the information that happens, any kind of activity. So this can collate activity within the application, but also any activity that comes out of the automatic robotic process automation as well. Finally, just to kind of summarize in regards to this to refer solution. So the benefits you really get out of this, again, automatic data extraction. That's what you're really getting generally from the Power Platform solutions anyway, but also the automatic extraction through unattended RPA means that you can do that at scale with multiple different solutions, just scraping the UI. It really gives you that power there. And with this product in particular, you've got that centralized hub. So thinking about it specifically in this kind of scenario, you've got a centralized hub where you can use multiple different channels, multiple different avenues in, using that RPA integration to collate those into a central hub. As with all of these, you've got the enhanced traceability, compliance, the auditing, everything that we've shown there. And as I mentioned, the multi-channel referral processing. So whether you get it via email, via forms, via direct contacts that can be transcribed, there's all these different ways that you can collate the information, and then an unattended process can take these multiple different channels and inputs in, structure them in that central solution, and then push that data back out. And finally, you've got that consolidated view from all the different angles as well. There are a number of different other potential solutions, as like we said, with the kind of scalability of unattended RPA, and did just want to mention another partner organization and piece of work that we've done in around ESR integration and HR people onboarding. So this is a solution that's been developed and increasingly improved over time. So this to support the kind of new starter process, the thing that, you know, I'm sure everyone's experienced, where there's that kind of joiners process, getting everything set up, all your account information, all of those kind of things, where linking in with Greenlight and Track and various other solutions within the organization was able to reduce that 35-minute process of recording everything, and especially high volume with potential staff turnover, where you can receive the new starter form that can be validated directly against ESR. So another sort of key integration that you're able to do under unattended RPA is to connect directly to ESR and pull that data in. And you can also, through integration back in, update the data in ESR too. So that kind of front to back process is totally possible. And then you've got things in here where you populate the Greenlight details, so that key solution, that CRM that they had at Berkshire, and then populate the details on Track as well. So we're automatically retrieving new starters from Track with this solution now, logging in that central app, pushing the data to Greenlight, and then that's also being pushed into ESR as well. That's the opportunity available there. And all the benefits that you've got through that, you talked about the time that you're saving, the much better visibility of that process, removing the backlogs, and also from a perspective that you really want to make sure that your candidates are managed and they get the best experience, particularly when they're joining the new organisation, that they really get that best first impression. And that's what that solution enables you to do. Have we got any questions that anyone would like to ask at this point? I will take that as a no. Just seeing that, what's the charging model? So I can probably hand over to my colleague Karen on this, but kind of from a Power Automate desktop scenario, there are a requirement of process licenses. So you would require a license kind of per bot, but that bot can be doing a number of different things. That will be discounted within the NHS framework, but you'd be kind of best off contacting your licensed software provider to get specifics on that. And Karen, I don't know if you want to speak to some of the opportunities that we can provide as well in terms of the managed service and support within that.
Yeah, absolutely. Thanks, Owen. So yeah, it really depends on the use case that you have and the kind of data that you're looking to be utilizing and how many bots that you'll need. So as Owen's saying, there's two different types, if it's attended or unattended. There is information on Microsoft's website, but the best way of actually, finding out for your kind of specific use cases is to contact your LSP or Microsoft. If anybody does want to kind of explore what opportunities are available for unattended RPA or attended RPA, and you want to talk through some of the challenges, we're more than happy to actually, do that as part of what we call our envisioning process. So we'll sit down, understand the challenges, understand where automation can come into play, and also applications as well, if they're relevant too. And then from there, we can help you figure out how many licenses you'll need and the relevant charging model from there with your LSP or Microsoft.
Thanks, Karen. It is also just worth mentioning in that context of kind of setting up your initial infrastructure is, like I said, with unattended RPA, you're going to be looking at virtual machines. There is part of the Microsoft package that you can buy a hosted version of that. So that is an option that you can look at if applicable. And also with anything like EPR integration or ESR integration, you'd be looking at sort of pre-infrastructure setup like virtual smart cards, so the ability to connect to those sources. So that's something to keep in mind. But obviously with web-facing things like Track, you've got much more opportunities to start with the existing Power Automate desktop software.
Hey, did anybody have any questions about any of the solutions we've shown or any of the work we've done with our customers, or any particular challenges you think that may come over from moving over to a more automated model? Again, feel free to put it in the chat. If you think about it afterwards, you can see if the chat's working, or what our contact details will be on the information that we send out, that you can contact us for you directly from there. Okay, no worries. Well, we'll move on to the next bit now. So I just wanted to let you know some more dates for the diary. So this webinar is part of the series, and the series is going to continue throughout the rest of the year. More information will be sent out to everybody shortly, and we'll put it on the website as well. But we just thought we'd want to let you know some of the upcoming webinars. So we're going to look at the latest release of Power Platform and some highlights from there. But other webinars will be dedicated to looking at things like Copilot Studio. Now, we did do a webinar of Copilot Studio recently, but things keep being added and changed to it and enhanced, so it's always worth us keeping up to date with that. We've done a whole new bunch of solutions as well. So the to refer one is one that Owen mentioned today, but we're also looking at risk management, DPIA, patient experience survey, and FOI requests. So that's some of the upcoming webinars. And just to let you know that we are looking to have an in-person event in London around about early July at the moment. The date is the 1st of July, and we'll be sending more information about that soon. Just before we close, I just wanted to say thank you very much, everybody, for attending. As this is part of the series of webinars that we're doing, we would really like your feedback on today's webinar, but just webinars in general. If there's additional areas that you'd like us to do webinars on, any feedback, if you would like us to contact you about any of the solutions shown or anything that you might be interested in. We will include the link to the survey when we send out the emails with the webinar recording on and the slides. But if you do want to leave your feedback now, please feel free to just scan that QR code. So we're just going to put, somebody's asked our contact details, and so I'm just going to put mine in the chat now. Oh, Beatrice has just done that for me. Thank you. And yeah, Owen, if you could put yours in too.
Absolutely.
And yeah, please do feel free to reach out to us. But like I said, when we send out the email as well afterwards with the meeting recording, our contact details will be in there too. So I just want to say thank you to everyone again for attending the webinar. I hope you enjoyed it. If you do have any questions, feel free to reach out to us. Otherwise, I look forward to seeing you on the next webinar.
Thank you
Thanks
very
very
much,
much,
everyone.
everyone.